I was like, I thought I knew.
Thank you so much for being here today.
Oh.
The Vermonters Caucus. It's great to have pizza and everyone here. This is like the most I've had in so long. So, definitely a shout out to V4A for hooking us up with the pizza. Thank you, Mary, for this. Appreciate it. And yeah, so I'll start with just introducing Mary. You want to say hi? Okay. Then we have the Commissioner, Dr. Bowen. Thank you for being here today. And Deputy Commissioner Kelly Doherty. Thank you so much for being here today. I'm just going to turn it over to Mary real quick, and then we'll get started. So
sounds good.
Go ahead, Mary.
I was fussing with my name tag, but I'll leave that. Jump into it and welcome everybody. Thank you for being here. It's lovely to see so many people, and welcome legislators and commissioners and deputy commissioners and all of you. Thank you. Just wanted to say a few words about how we've been proceeding with Age Strong Vermont, Vermont's multi-sector plan on aging, and just talk to you a little bit about our steering committee, which was formed back in, seems like a long time. I think it was 2021. And this has been a unique partnership between state agencies, departments, and advocate partners such as Dale, Department of Health, AARP, the Alzheimer's Association, in the past, Cove, SASH, and we're growing our ranks, which is exciting. And our job has been to provide strategic direction for the development of this plan and now the implementation of Age Strong Vermont. And we've been meeting at least once a month. We've participated in multi-state collaborations and learning events to learn from other states. And we're now becoming a state people point to learn how to do it. We have worked with evaluation consultants and with generous partners such as the Vermont Community Foundation, who's helped us to enhance and improve our strategic organization, as I said, evaluation, and to stand up a communication strategy. There's been not a lot of funding to do all of this, but now we have for the first time, a project manager, and her name is Sarah Keating, and Sarah, I know, is here somewhere. There's Sarah, who is lodged in I think the Aging Services Division at Dale. And so that's very exciting. As I said, it's been a unique collaboration with these advocates coming together. We're now one of 24 states in the country who are in various stages of creating their multi-sector plans on aging and implementing them. And I wanted to mention we have other full-time jobs. Thank you.
Yeah, and I also emailed out kind of a list of where we are in implementing and what's going on with Age Strong. And then Sarah brought a handout also, so make sure you grab one of those. So thank you so much, Mary. I'll turn it over to Commissioner Bowen. Thank you.
Thank you. And I'm going to go through some of that as well. I know that Rebecca's going to put up a PowerPoint on the screen, so we can give her a second to do that. While she's doing that, I want to thank everybody that everybody thanked so far. I also just want to call out, in addition, Jacob Hemerick and Chris Cochran from the ACCD and DHCD. These have been exceptional partners in terms of including Age Strong into the work that they are doing. Philip Lapis and Sherry Rockcastle from Department of Financial Regulation, Sydney Robillard and Sarah Knight from DOL. The reason I really want to highlight this is because that's the village, right? It takes everybody and the work that they're already doing and being able to make sure that Age Strong Vermont is represented in there. Anyway, I am Dr. Jill Bowen. I am the commissioner for Dale. And lots of people get the name wrong. I know that Representative Woods always corrects it. I'm always cheering for you. I don't know if you hear that when you're, but it is the Department for Disabilities, Aging, and Independent Living for Vermont, and I appreciate that. Also, the Division for Adult Services Division is what ASD stands for, and I do want to let folks know that and to thank Angela Smith-Deng, who is here. Say hi. She has been the ASD division director for some time, and she was really instrumental in moving Age Strong forward. and she has been promoted to deputy commissioner for the department. So Angela McMahon is now the division director. She's online, so she may not, be able to hear me. But I also wanted to welcome Sarah, who is now our project manager, and could not do that without everybody's support. And I do also want to thank Dan Noyes for his incredible support for older Vermonters and for the legislators in general, the triple A's who are incredible, Mary. So it's just great to have partners and to be able to do this work. I'm here less than a year. It's about 10 months, maybe a little more than 10 months now since I came here. Age Strong Vermont was one of the things that pulled me here because I'm like, this is amazing. So if you're not here and this is amazing. There's very few states who have something this comprehensive, this thoughtful, and this responsive to, the growing demographic. I'm very quickly going to go through this PowerPoint to celebrate the year one update. I'm going to advance it. Who's got control?
Here. Next slide.
Next slide.
If it will go.
Next slide, please. Okay, so I really want to thank you. I'm really glad that VDH is here at the table. We are partners. It's under the joint leadership of Down VDH that we were able to establish the infrastructure needed to create lasting change. And when I say we, I guess it's the royal we now that I'm here, but it's really all of the work that you all in this room have done. So next slide, please.
Which way?
Yeah. Forward. Okay, so for those who are not as aware of the details, but there are 7 goal areas, 30 objectives, and 164 strategies. So it was easy peasy to put this together. And all of them are so critically important. Affordable. Good job. Okay. Affordable aging, healthy aging for all, social connection is key, infrastructure for the future, valuing family care partners, the fight for justice, and strengthening systems of support. And since this is so incredibly relevant and so really personal, that people who are living this, experiencing this, have families and friends are part of this, because you really hit every major area that needs to be nurtured. So just looking at Age Strong Vermont progress on the plan, on the left side in the green, which I won't go through in each of the next several slides, is what it's all about. On the left side, the basics, but on the right side is what happened this year. And so I'm just gonna, mention a few of them, the stuff that's in Vermont green. Developed and published the year one annual report. I mean, really, that's just great. How many of you have actually seen and held? And yeah, you're all nodding. Great. This is the right group. Of course you did. Designing the implementation structure. It's really, what do you do on year one implementation? This is great. Next slide. So now we'll go through each of the goals. So again, I won't read the objectives under each because you're familiar with it, you're in all the materials, but I'll pop some progress. On affordable aging, we were able to enhance the workforce, the older Vermont workforce, via support from Higher Ability, and also increased Meals on Wheels access, in part due to legislative support. Next slide. Healthy aging. We began implementation of the arthritis physical activity programming at the triple A's. So that must be amazing and exciting. And enhanced mental health integration. There's a number of ways in which that happens. Next slide. Under social connectedness, the social connection map is really cool. When Angela showed it to me, I think I spent an hour just playing with it. It really is a wonderful way for people to find the community-based services that are in all communities across the state. So it's very interactive. It opens up and then it layers and layers and layers. And so it really makes it easier for people to find another way in which people can find out more about what's in their neighborhoods. And then
Where did you find that, Jill? Is that on the department's website, on the AAA's, all of the above, or?
well, I don't know if it's on the AAA's, but it's on the department's website.
Okay.
Yep.
And there's a
And we
link
have a
on the
link.
report.
Yeah, there's a link right in the report. We're trying to put the link out everywhere to make it not a challenge to find the link, right? And yes, the development of an intergenerational programming that's going to include adult day and childcare center planning, just that multi-generational concept is, fabulous. Next slide. Increasing infrastructure. Just the launching of Act 186, the reason why it was one of the things that was on here that I popped is because how important it is to, really identify the intersection of age and disabilities of all sorts, in this case, developmental disabilities. But there is a profound intersection, and Act 186, the housing pilots really kind of highlight that. So I appreciate that and wanted to pop it here. Also, I popped enhanced microtransit while updating state design standards. I mean, being able to get around is everything. And the challenges here are so dramatic that really appreciate the work that has gone into that. Next slide. I just wanted to show the continuum for housing and supports for older Vermonters, because there is a lot here that can be enhanced, expanded, infused. So yes, many live in their own home. Many have been downsizing, living with family. Home sharing, which is extremely, you want to wait, right? Home sharing, which is incredible. Every story there is beautiful. Every story about home sharing brings is a win-win-win. I say 3 ways for the community at large. And then you can see senior living. This is making its way through the community options through to the higher intensity options as needed. But it's important to also know that there's emergency housing continuum, because there are still folks who don't have any one of those places to go, and that's not okay. So Age Strong Vermont is on it. Next slide, please. Is enhancing family caregiver support. So we know how huge the family caregiver community is, and how much support is needed. And this year, they implemented the T-Care assessment tool for caregiver support, which is really important in terms of really objectively identifying where those needs are. And then also made permanent policies allowing family caregivers as Medicaid providers. Yes. And then expanded support groups and respite services, all really key. Next slide. Elder justice. Unfortunately, this is still very much a concern. And, the importance of aligning adult protective services, state statute with federal rules happened. And it is to the advantage of folks who are experiencing any kind of vulnerability or risk to have that level of that layer of protection. And then expanding the financial exploitation prevention, education, really important for folks to know and be aware of just how prevalent financial exploitation is for older Vermonters and across the country, in fact. Okay, strengthening systems of support, just popping improved emergency housing coordination. The coordination, which is something we were just talking about, is really, really, even just in the time I've been here, I've seen it intensify, coordinate, integrate across departments and agencies. And so that kind of collaboration with long-term care placements for those who are homeless, just looking really for something that's less transient, less temporary, and more permanent. And then the assessments of Vermont 211 and the AAA helpline practices is really great, is real important entry points. Next slide is next steps. We're in year 2. Congratulations, we're in year 2 of implementation. 10 years seems like a long road, but already we're in year 2, so it's pretty amazing. So I already identified the new director of adult services and new project managers. Sarah Keating is in the room, and everybody I think knows you now. That's a good project manager. Right? So expanding impact this is on the horizon now is next step, expanding impact through a model for collective impact, right? That's how we need to do it. There's a 3-tiered structure with a steering committee, strategic groups to drive specific initiatives, and broad network support to build advocacy. And I know you're working on stuff as well. And align Age Strong Vermont with key state priorities. That's really important because it shouldn't be in a silo. Age Strong should be part of the way in which we do business, right? Expand on the infrastructure and partnerships developed in year 1 to leverage the strong foundation to implement actions in year 2. That's the way to benefit Vermonters across the lifespan, right? You got to build it in with the entire lifespan view, right? Because everybody's impacted, individuals, families, communities, and that will benefit Vermonters and create communities where all Vermonters can thrive at every age. Thank you. I have to say, she said good timing, like I was within my time frame. I got a lot of help doing that.
Looks like we got a couple of questions. I think I saw your hand first.
Yeah, it's fine. Hi. So I was just wondering, you mentioned that the hotels and motels were one of the resources for emergency housing, and I'm wondering if you happen to know how many older Vermonters are currently utilizing that, and are any of them at risk in losing their housing with the changes in the hotel and motel program imminent?
Okay, so I can tell you how many are on Choices for Care, which is, in many ways are most vulnerable, but it doesn't cover everybody. So there are 20 people on Choices for Care, 10 of whom already have an alternate plan. The plan for folks who are already in a system other than the GA system is to pull them out of that system as much as possible and to utilize what's available within that system. So of the 20 right now, 10 of them have alternate plans. And those are just being enacted, so they will be able to move. And the other 10, do we have an update? Because I know Angela's been working directly on this.
The other 10, the plans are in the works, I would say. The AAA case managers are working really closely with those individuals on their plans. Some are seeking, in actively seeking apartments. Some are looking for long-term care placement, and so it's working on finding that match. There are plans in the works for most people. There are a few people who are planning to stay in the hotel in private pay after that opportunity, and that's their choice if that's what really they want to do.
Yeah. So this is, as you know, not an easy task. And Angela's role is to represent the department and coordinate with those that are on the ground, like AAAs and case management services and all of the different efforts. DCF leads those meetings, but it is AHS very focused and intensive. So we know about those 20 and can kick in the Choices for Care options. There are others, we have, almost a third of the population of folks who are over 60. So it's good that you're going to see that represented everywhere. So there's challenges for older Vermonters who are experiencing any form of housing insecurity. There are challenges for folks who are in their homes because it's very difficult for them to manage their homes. There are challenges with folks who are in their homes but isolated because they don't have good access to transportation and if it wasn't for Meals on Wheels, they might not have two things. They might not have the food that they need, and they might not have any contact with anyone other than that. And as long as I'm talking about Meals on Wheels, I just want to say a general thank you to the volunteers, many of whom themselves are retired and over 60. That is the backbone of the Meals on Wheels. Volunteers who go out to actually engage with people and bring those food. Many of them are over 60. And that's the majority of the folks who provide the support through Meals on Wheels of those volunteers. So. Mhm.
Thank you for mentioning the work that Meals on Wheels is doing. Teresa, you had a question?
Yes, I just also want to respond to Michelle. There are lots more people over the age of 60 or 65. And that's tracked in the hotels right now. That's tracked on a DCF website. I have updated information for people in case you want to know that updated information as of last week, which is not what's on the website. So I can provide that to people. And yes, they will be impacted by whatever decision the governor ends up making on a revised budget adjustment act that we will be sending him shortly. My question was more of a comment and a thank you for figuring out how to have a project manager. Because something of this magnitude that's going to span over a period of years, it's kind of, I'm always famous for saying, like, if it's everybody's responsibility, it's nobody's responsibility. And so having a key lead to, make sure that the pieces are moving along and, modified as needed I think that's great. So I just want to say thank you for figuring out how to do that.
Thank you, Sarah, for being here.
All right. Any other questions for the Commissioner? Okay, I'll turn it over to Deputy Commissioner Doherty.
Thank you. So I'm Kelly Doherty. I am a Deputy Commissioner at the Department of Health, and I'm really honored to be here on behalf of Dr. Levine today, who had another commitment. And I just want to highlight some health-focused priorities that are in the Age Strong plan, as well as some examples of progress being made in those areas. And I also want to thank and express gratitude for all of the partnership around this work, because no one entity could do this alone. So I won't repeat all the names that were already said. So in the Healthy Aging for All category, the real focus in this area is to enable independent living, engagement in community, and maintaining one's quality of life. So in the chronic disease arena, the Department of Health is working on the next phase of our 3-4-50 initiative, which is addressing the 3 behaviors: tobacco use, physical inactivity, and poor diet, that contribute to 4 diseases that cause 50% of the mortality in Vermont. So we're working on that. That's an initiative that's been around for a while, but we are sort of looking at what's next in that space. With respect to physical activity, Commissioner Bowen mentioned the arthritis physical activity programs at the AAAs, and there's also been some expanded falls prevention efforts that have been going on. And the BOLD program at the Department of Health has launched campaigns promoting brain health and the benefits of using the annual wellness benefit in Medicare. So that's really important. And then our cardiovascular disease program, in partnership with One Care Vermont, has been hosting hypertension learning sessions. So a really critical health issue among older Vermonters. With respect to social connection, I just want to re-emphasize how important social connection and preventing isolation is, really among everyone, but particularly around older Vermonters. And the former Surgeon General, Vivek Murthy, as you may know, declared loneliness and isolation a national epidemic. And it's associated with a greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. And it's also a key risk factor for suicide. So really can't emphasize enough how important the social connectedness aspect of the Age Strong plan is. And I'll echo what Dr. Bowen said, which is the importance of those cross-generational interactions. So she already mentioned the social connection map, which is very cool. I encourage you all to check it out. There's a link in the plan. And another example is the UVM Center on Aging has been hosting film screening series and intergenerational discussions focused on the importance of social connection. So a nice initiative that's happening that not only raises awareness about the importance of social connection, but also brings in that intergenerational component that's so critical. Around housing and transportation, we have some healthy community design work that occurs at the health department in partnership with a lot of other state partners as well as municipalities to support downtown mixed-use development that encourages walkable, bikeable, and generally more accessible communities where resources are more densely packed so that folks can access them more easily. We also, the health department has in our 12 offices, local offices around the state, we have staff who are, they're called chronic disease designees. And this past year, their work plans were updated to include supportive transportation options. And finally, VDH and Dale with other partners are working on building dementia-friendly communities, and there's actually been a lot of progress in the Middlebury area in this issue. So the final thing that I'll say is in the strengthening systems for support, Dr. Bowen mentioned making Vermont 211 and the AAA call centers sort of more age-friendly. That's also happening with VT HealthLink, which is the state's alcohol and drug resource center. So it's a call center as well as a website. So really doing some work with the folks in that call center to really elevate the issue of drug and alcohol use among older Vermonters. And I will close there. Happy to take any questions. Chair Wood.
I was just wondering, I remember Dr. Bowen mentioning the Agency of Commerce and Community Development, and I didn't hear Agency of Transportation. And I'm just wondering, you were talking about walkable, routable, all those kinds of communities, and just wondering if you had collaboration with the Agency of Transportation.
Yes, definitely. Yes.
I don't know why it didn't pop.
Yeah.
Thank you to the department. Yes.
Is it, just such a huge issue and when cutbacks and some of the, what do you call it?
Public transportation.
Public transportation, yeah, I guess I was thinking, cutbacks in some of those areas, I'm sure it's impacting. And I appreciate the fact that, V-Trans is really also trying to look at, more on-demand kind of services, which are particularly helpful for older Vermonters to get to medical appointments and things like that.
I also think that microtransit is like super important because there may be a stop not that far, but folks can't get to it,
Yeah.
right? So it's almost like just out of reach, and that's incredibly frustrating. And then there's nothing you can do about the fact that you can't get 2 blocks, but you can't, and there's the bus.
Yeah.
Yeah, go ahead.
Thank you. I'm Representative Mary Howard from Rutland City. And I just wanted to make a comment regarding health and social. There is an agency, it's called Vermonters Center for Children in Rutland City. They have a indoor heated pool, which through the rec department has offered classes for seniors. I went to my first class not knowing anyone and immediately was welcome. The group of the mermaids, and we refer to us as the mermaids. And I can't tell you what an enjoyable group that is. We do our exercises in the pool, we chit chat. The first time I was there, they said, Mary, would you like to join us for coffee? Because they all met at a local place for coffee. Once a month, we have a luncheon. And some of the people who no longer can go to the pool, come to the luncheon. We also do field trips. We have gone to museums, we've gone to, play. One of our lifeguards also was in charge of a high school group that put on a play. We all got together and carpooled and went to the play. I mean, the social life is so important. And then in June, they closed the program.
Oh.
I can't tell you how upset everyone was. We wrote letters. Some people opted to go to Pico. They have a facility there up on Route 4 near Killington. And other people opted to go to Castleton. But like Castleton, you have to drive. To Pico, you have to drive. And in Castleton, you have the parking lot is like away from the pool. The pool is not as warm. So after, speaking with the mayor and speaking with the director of the rec department, we were able to come back and have our classes 3 times a week at the VAC. And I can't tell you how enjoyable it is. And everyone is like, I saw one of the members here yesterday visiting, and I was like, oh my gosh, it's like a whole week. Had one woman who celebrated her 100th birthday, and we had a birthday luncheon for her. She no longer can come to the pool, but I can't tell you how important just, that one thing for so many people. I mean, they come in wheelchairs and canes, and we have a great time in the pool. So I'm just so grateful.
Go mermaids.
Yeah.
Yes.
Mary, you're showing the importance of people speaking up,
Mm.
Oh, yeah.
So not just saying, oh, okay, it's gone, but speaking
No,
up and
no,
saying that,
we
saying.
definitely
what
want to
Nina
get
was.
back and
Yeah.
we,
You fought
wrote
for it.
letters
Yeah.
and we, spoke to whoever I had to speak to.
That's great.
Even the director of BAC.
Unity.
Yeah.
So, I mean, we all pay for the classes, but, we enjoy it so much.
That's great.
I miss it being up here.
Forget about the companionship aspect of a lot of these wellness classes from around the state, whether it's Tai Chi or Balance or any of those. It's just bringing people together on a regular basis where they can interact with each other. So, all right, thank you. Mary, would you like to say a few words before
Quickly,
we
but-
wrap up here?
Just want to be in the mermaids. That sounds totally great. I'm looking over at Rosemary Green, our executive director from Southwestern Vermont Council on Aging, to see if we can, who knows what we can do here. Start up a new wellness
Do you
program,
have a
but
pool?
I don't have a pool yet. A mermaid needs one, so I have to work on that. But yes, just very quickly, because I don't want to I know we're probably pressed for time. Just really want to thank the legislature for all they've done to improve affordability for Vermonters. I think it's just, and of course that includes older Vermonters and disabled adults. And the commissioner of Dale Commissioner Bone already spoke about a number of those initiatives, but and certainly we have a lot of champions in the legislature, especially Dan Noyes and Chair Teresa Wood, who I think may have had to leave, but certainly 15,000 more older Vermonters and are now eligible for Medicare savings programs as a result of the legislation that increased Medicaid support for that. And that is huge. That helps them cover premiums and other unreimbursed expenses they could otherwise not afford under Medicare. Medicare is not free, and this really helps out a lot of people. Only 2 or 3 years ago, the legislature started supporting Meals on Wheels funding at the state level. That had not happened in Vermont. That is exciting. We, by the way, are asking for 2 million more this year. So please keep that in mind. Also, I want to mention the treasurer's workplace retirement plan called Vermont Saves, because part of Age Strong Vermont is strengthening savings for retirement across the generations, right? So that is going to be a huge help for our employees out there who do not have access to employer plans. Those. And then also home and community-based services, just, continuing to increase the rates of pay for those services is critical. And our legislature has been responding to that and also seeking to have the agency conduct studies annually, so we know where those rates should be based on objective measures, and so that our legislators are informed about that when they are budgeting. Other things that are happening this session, Social Security income being exempted. Thank you, Representative Noyes, from state income tax. Tax credit has been proposed for caregivers. So that's another affordability connection, right? Because that frees up and brings more cash into your household when you're a caregiver, which is extremely important. We would love to see more funding for respite for caregivers. Again, just giving them more opportunities to access respite. So to stay healthy and to be able to continue their caregiving. And some other things, improving SNAP, improving and enhancing our SNAP benefits across, again, populations, including older Vermonters. And I want to mention back to Age Strong Vermont and its implementation that Dan Noyes has proposed a bill to create a commission to help to assist with implementation. So that's it. Lots of good stuff.
Yeah, I don't think that one's going anywhere this year. I had another one I put in to create a long-term care trust that actually just had someone from MIT reach out who's doing a research project on making sure how states are planning for long-term care, and saw the bill that Representative Iacovone and I put in and was asking about it. So I guess it's something that passed either the House or the Senate in the 80s, kind of resurrected it. Maybe, I don't know, not this year though. Definitely one of the things that I've been thinking about a lot lately is our Medicaid reimbursement rate in the state, and any issues we're going to have with the federal government coming up, as we're seeing the CR that was just passed, which is good to move the funding at least level, better than nothing, on the Older Americans Act and the funding that we really depend on to run Meals on Wheels and a lot of our programs, the AAAs and everything. So glad to see that was in the CR to at least move forward, but I am really nervous about the Medicaid reimbursement rate. Just to throw a number at it, each 1% is 19 million. So
These are the FMAP.
on the FMAP, 1%, 19 million. And yeah, I mean, we just don't have the capacity to backfill that. And it's pretty scary. So if anyone wants to call me at 3 o'clock in the morning, I'm awake.
You need a warm pool.
Yeah, right. All right. Anything else anyone who wants to bring up today? It's so great to see everybody here. Appreciate it. All right. It's been good. Thank you again so much for
How is Kelly?
Oh, yeah,
Kelly's here.
sure. Yeah, Kelly, do you want to say a few words about the bell's ringing now, so.
Sorry,
I think we ran out of time. That's all right.
It's on the next one.
Bye, Belle.
Yes.
I saw you here.
It's all right.
Yeah, so we'll go up to the floor at 1. If anyone wants to come up there, say a few words, introduce y'all to my colleagues on the floor, that would be great.
Oh,
We'll be
is that
there
now?
next.
Oh, great.
Yeah.
Oh, great. Let's go.
Introductions and a bunch of stuff. There's devotional, so.
That's nice.
All right, thank you, everybody. See you up there.
Good to meet you, Mary.
So much.
Sure. It's like, well, this is great, it's like great work, and I feel really good about it, and I only see the